things. Thank you. Excellent. So I'm going to move on to our last speaker now, which is Raselle, who's one of the psychologists who works with us at Guy's and St Thomas's, and has done lots of really amazing things that she got here. But she's going to talk specifically about COVID and how we manage this. I'm going to hand over to you, Raselle.
Okay, thanks. So if I can share my screen, Gary, do you need to remove your slides so that I can share? Is that how it works?
No, you just need to unshare.
Let's see.
That's it.
Okay, great. Okay, let's see if I can share now. Okay, is that the screen up?
Yep.
Yeah, that's right.
Yeah, great. Okay. So hi everyone, I'm Raselle. I'm one of the clinical psychologists at Guy's and St Thomas's, and today I'm going to be talking about how the psychology team are supporting our vulnerable patients. So to give a really brief overview, thinking about some of the reasons for the vulnerabilities, the psychological impact of COVID for our patients and their relative, what the psychology team offered, a little bit about what we've learned during the process, and what we can keep in mind as we move forward potentially into this second wave and the new normal. So in February, March, there were these messages that appeared in the news about this thing called coronavirus or COVID-19. There were news bulletins and messages everywhere about the need to protect others, to wash their hands, to not overload the NHS, to stay at home. They then were told that they were extremely vulnerable, extremely clinically vulnerable. They received messages and letters in the post, and they were ultimately told to stay at home. So what challenges did this bring? Well, for many patients, it brought challenges and changes to daily activities. Suddenly, lives were restricted, what they could do, how they did it, whether that was going out, shopping, or meeting others. They were not able to have contact with loved ones in the same way, or were not able to receive the same care from families in their communities. They were having to move to ways of virtual contact or seeing people through the glass or at the doorstep, and there were new reliances on things like the phone. It changed massively the ways of working. People were working from home if their job allowed, or if their space at home allowed. There were some job losses. There were changes to children going to school or going to university, and parents were becoming homeschool educators while also managing sickle cell pain and crisis. People were having to find different ways of maintaining their well-being, thinking about different things that they could do for fun and relaxation. And we were very aware of people not always having access to outdoor space. People were having to be more vigilant of their actions, whether they were going out at 2 a.m, they were having to wash their hands all the time and to keep that 2-meter distance. They were dealing with a huge amount of uncertainty, not making plans, not feeling financially stable, or fearing this new illness. There were changes to ensuring their basic needs were met, whether that was having enough information to make decisions, whether it was getting food or being able to pay their bills. There were also huge changes to healthcare, so a move to telephone or virtual appointments, postponed appointments, and changes to routine care. So since this time in February, March, people have understandably responded with a real range of feelings, but a lot of those have been around loneliness and isolation, anger and frustration about why this has happened, anxieties about their health, their families, what their future might look like, fear of catching coronavirus, getting ill, giving it to others, fear of the unknown, fear of going into hospital, and fear of death. This was especially the case with the news from people from Black and other ethnic groups being more at risk. There was also a lot of sadness and grief, what's been lost by them feeling restricted by shielding at home, what they've not been able to do to keep emotionally well, and potentially sadness in their communities over losing people to COVID. There was a lot of confusion around not knowing what was best, feeling trapped, having a lack of control, feeling hopeless, feeling like it was really unfair, that it was another thing that people had to deal with on top of managing sickle cell. People felt really overwhelmed. There were also, though, some quite positive remarks about the COVID situation, that relief of pressure to do normal activities, to look for work or feeling quite content to be able to work from home, to be able to rest with pain, but also not have to take a sick day. There was also that permission to take a break from everyday demands. There was also more of a feeling of understanding, maybe for other people, knowing a little bit of what it was like to live with the health condition, to live with difference, to live with fears of unpredictability and the unknown. During this time, there was a big drop in emergency care to the A&E and to the day unit for us. So one of the difficulties that the team had around this time was that people were delaying necessary care due to not wanting to catch COVID, potentially putting themselves at risk of sickle cell related harm while thinking that they were keeping themselves safe. So after months of being at home with the messages of being told, shield, 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 there were then messages and ideas of coming out of shielding. Suddenly there was an idea that deaths were reducing. So they were being told to return to work, to create support bubbles, to be able to act as usual. But yet there was some relief from some people, but also this brought a huge amount of mixture of fear and uncertainty. Some people were too afraid to leave the house, while other people were quite used to staying indoors. Other people couldn't guarantee that their COVID environments, people's houses, or going to work was COVID safe or secure. They were noticing that some people weren't wearing masks or not keeping their distance. So it didn't feel safe for them to go out in that time, even though the government was suggesting these changes. So throughout this time, what did the psychology team offer? Our aim was very much to keep the ethos of multidisciplinary care, thinking about people's physical well-being and people's emotional well-being. So we needed to keep ourselves visible and accessible to patients, relatives, and staff. But this was related in part to increased communication, signposting, making sure that we were giving out accurate information, such as the NHS and the GovUK websites. We were offering additional triages to our waiting list patients and our more complex patients to normalise some of the people's worries and to also offer more one-to-one support where needed. We continued to offer clinic contact, so when people were meeting with the medical teams, to offer them some form of review so that they were having access to that support for both their psychological and physical well-being. We also worked closely with the medical and nursing teams to make sure that we were communicating in different forms, so thinking about letters and emails, and we created a psychology tips page to be able to promote some of that well-being. So changing our use of technology was key to our success in supporting people. We quickly moved from face-to-face appointments to telephone sessions and the Attend Anywhere virtual platform, which we were piloting anyway. Our DNA rate for follow-up sessions in the previous 3 years between March and August sat at about 36%, which is about average for psychology services, maybe a little bit less than average. But between the period of March and August of this year, our DNA rate reduced to 13%. So we were seeing a lot more people during that time. We used virtual platforms to offer people psychoeducation workshops, which they could watch in their own homes rather than having to attend the hospital. So some of these included workshops around managing anxiety in the face of uncertainty, thinking about sleep hygiene, thinking about pacing and boundaries when people were shielding at home, and thinking about ways of connecting to well-being. We also moved our virtual support group. We moved our support group, to it being virtually. And we also offered our usual transition tours, so a tour that we would provide to some of our patients coming from the Evelina Hospital to the adult service. We created an online system to be able to do this instead. So unlike some of the other psychology and mental health settings, we continue to receive referrals, and as well our activity increased. So thinking about briefly mentioning the virtual support group, we worked really closely quite quickly with the communications and information governance teams to be able to create policies and procedures around virtual group working with patients. And we, in that time, had an overall increase in attendance, and we had more new attenders compared to previous face-to-face meetings. Reasons for this might be that people weren't having to travel. So regardless of whether they were in pain or not, they were able to then attend the meeting. And our feedback going forward for the groups is that there's a preference for both, an equal preference for virtual support group as well as face-to-face meetings in future. Our feedback suggests that these groups have stopped some feelings of isolation, feelings of loneliness, and were a really helpful information resource for people. One of the other elements that we created was a COVID patient pack, which we used in part for people that were on wards and isolated from their families at this time, but also for people at home who were stuck, bored, and understandably very anxious. So it contains materials around psychoeducation, around anxiety, thinking about ways and strategies of coping with difficult feelings, thinking about well-being and self-care, ways of creatively reaching out to people, and some cognitive reframing elements. So rather than thinking about missing each other, it was about protecting each other. So we were using language as a way of being able to support people. There were also mindfulness exercises and also activities to reduce boredom. The amount of adults and young people that don't do things like colouring in or crosswords or Sudoku puzzles or things like that. So we added those things in as well. A lot of our time was around supporting our colleagues. There was a huge demand for staff. There was a blurring of lines between work and home. There was a lot of uncertainty for people. There was a lot of pressure and change. There was pressure to be a hero and to not have any demands and to be able to go above and beyond at all times, while also managing some of those anxieties that staff had. So we, as a directorate, we offered daily staff support, so across all of the wards and also for individuals. We responded to a trust-wide programme as well, so we were part of a response team to offer one-to-one or group support to all professionals within Guy's and St Thomas's. As I mentioned, this came in different forms, so daily staff support, drop-in sessions, face-to-face, virtually, and that was 7 days a week. We also highlighted and signposted a lot of staff to things like staff support, the wellbeing zones, and used ways and took time to be able to support each other within the psychology service as well. While we are sometimes the containers of the containers, we also need support for ourselves, so we made some space to do that. The Haemononc teams, I think, offered around 270 groups or individual sessions since March. And offering this space to talk through concerns, feedback has suggested that it's reduced burnout, it's reduced some of the stress-related sickness absence, and of course, all of those things improve quality of care for patients. COVID has also highlighted the health and other inequalities faced by people from Black and Asian ethnic backgrounds for both patients and colleagues. This is particularly pertinent for our sickle cell population. So both patients and staff were concerned about their increased risk of dying from COVID because of the ethnic group that they were from. COVID, as we know, is not an indiscriminate killer. The pandemic has had a disproportionate effect on ethnic minority groups in greater numbers, but also people dying at a younger age than their colleagues. So this was something that we needed to address. There was a significant increase in contacts from both patients, but also from staff as well, who were affected by George Floyd's death and the BLM protests that were occurring during the COVID lockdown. For people, it triggered feelings of being less important or less valued by society. People described shame and difference and lacking choice in not being able to join those protests or to share their views. Also around this time, people's normal support networks, their conversations, their informal conversations that they would have with people, all of those strategies weren't as easily available as a result of COVID. So as part of the support process, we offered spaces and brought up with people their feelings about the BLM protests and also around the links of COVID. And we also facilitated special support groups for patients to be able to discuss this and to really share their views and ideas and to know they weren't alone in their feelings. We also facilitated some trust-wide events to discuss the impact of racism amongst staff. But also we were in these spaces able to advocate the experiences of people living with sickle cell, to know that there were additional multi-layered experiences that people were having in their choices, and some of the ways that they might have been acting or responding on the wards when they were both in a COVID insecure, potentially, environment, but also experiencing pain. We also facilitated one-to-one meetings for staff fearful of how COVID could affect them and their families as a person of colour. There were, of course, successes and limitations. So the staff and patient surveys suggest that over the COVID period, with the services offered, 90% of people have rated the services that we've offered either a 9 out of 10 or above. And we do want to keep some aspects of virtual working, those that keep us accessible for patients that are in pain, thinking about some of the workshops and the virtual support group, but also in ways that are efficient for our time in reaching people, in being able to provide educational events for people that might be working with people with sickle cell. But of course, there were some limitations as well to what we were able to offer. Using virtual platforms and supporting people at home. Not everybody had access to a computer or didn't have strong enough data or Wi-Fi on their phones to be able to join the meetings or to be able to attend anywhere. There's a certain level of technology required and skill required to be able to join some of those. So it's not always accessible for everyone. We also needed to consider aspects of confidentiality for our patients. So people were being offered psychological therapy in their homes. Could they talk openly? Could they talk without the fear of somebody in the next room listening? Also, were we able to offer the same quality of care and experience? In psychology, much of what we do is collaborative. It's about working alongside people. It's about sharing psychology. And we rely a lot on some of those non-verbal cues, some of the expressions to help us to understand the people's experiences, the things that are not said so much. So much of the telephone working has a limitation in that ability. It also stops us being so creative in a way of being able to help people express themselves. So we often use materials such as drawing, or we use Play-Doh to be able to support people's speaking. We do things like walk and talk sessions for people that find it easier to speak in that way. We also couldn't do some of the more experimental work. So for things like needle phobia, where we might offer some exposure therapy in things like the day unit, we were limited in that way in what we could offer. We also wondered about the idea of accessing psychology in general. Should this be the only experience of therapy that they have? Are we getting to the challenges? Are we looking at, or is COVID overshadowing the idea of looking at the emotional well-being for people who are affected, their quality of life is affected by sickle cell? We also lost building some of those quite unique relationships in this time. So much of what we do in sickle cell is about building those relationships, and it's so much about trust and being available, and that was reduced in some ways. Also in other ways it was increased in many ways, in the sense of that we were able to call people or meet with people at a time that suited them. We were reducing travel, so people were it was less of an impact on people's time as well. We also reduced some of our face-to-face MDT working, so we were potentially less accessible to staff in some of those informal moments for patients and both staff on the wards. And this is an important part of our ability to be able to share our patient understandings, to be able to think about team consultations of what might be going on, and to be able to offer support in that moment. We, as I mentioned, continue to keep our referrals open, and there has been an increase in need, which means our waiting list has increased quite significantly for one-to-one therapy. So potentially, as a result of COVID, people are waiting longer for support at a time that they need it really more than ever. So with that in mind, we're trying to think again creatively about ways that we can continue to support people in accessing psychological knowledge, to be able to have spaces to talk and share their experiences through things like the group as well. So what have we learned? So much of the feedback about the experience of coming into hospital for sickle cell patients and thinking about COVID has been about the value of relationships, the value of trust and communication for parents and carers. And that's not just for psychology, but for all of the medical teams. We represent a system for them that they rely on. So very much the feedback was around how much we were in contact with our patients, how much we were able to share, and how much they trusted the information that we were able to offer, and that kept people safe, knowing that the teams were available to them by phone, coming into the day unit, or eventually coming into hospital when they were in significant pain. Knowing that was available was really important. Also, the importance of that flexible team working and support, being able to respond when needed in different ways, whether some people were on a rota system of working from home while other people were on the wards, being able to be available to each other and offer that support so that there was a true MDT approach. But also the importance of, in this time, COVID affected all of us. And there was a real need to be able to recognise the need to look after ourselves and each other in difficult times. So what are we facing next? There is so much uncertainty for people, people not following the rules, potential another lockdown, or the pressure sooner than people are comfortable with to return to this pre-COVID way. That will be unseen, really, and I think there is that element of uncertainty for all of us in what that might look like. So that's something that we're having to hold as a group, and also to hold for our patients. When we're thinking about moving into a second wave and the new normal, we've found the Face COVID strategy really helpful. So thinking both for patients and colleagues, peers, people you might come across in your teams, being able to think about focusing on what's in your control, being able to acknowledge those thoughts and feelings and to really normalize those, being able to, rather than thinking about all of the things that are unpredictable, being able to come back into your body, to be able to stay present in the moment, being able to engage meaningfully in what you're doing. So not doing it because you have to, but doing it because it's something nice to do. So if you're watching Netflix, if you're having some time to escape from all of the worries, to do that and to really be present within that. Similar to that, being committed to those actions. Also sharing some of your views and feelings, opening up to others and helping people to know that they're not alone in the way that they're feeling. Identifying resources has also been a really important one, and helping people to be creative in using those. So thinking about people getting onto Zoom or being able to suddenly connect with their neighbours in a different way, but also to keep themselves safe and to follow some of those rules. So to keep that distance, to disinfect, and to, in thinking about resources and all of, and distancing and disinfecting, thinking about keeping up to date with the news and media in what's the right thing to do at the time, but also not overloading yourselves with that. So that's the presentation from me. I'm aware it's got very, very dark in my office. So I'm just going to turn on the light.
Thank you very much, Raselle. I think that's a great summary of how the team really kind of stepped up to all the challenges that we had. So again, just open the floor for questions. We've already got 5 minutes or so if anyone's got comments or questions for Raselle. Can I just ask, you showed the resource, the COVID Times. Is that available for people?
I showed the resource for
how to cope in COVID times. Is that widely available?
So at the moment we've been sending it out to patients via post or email, but definitely that's something that we could share on the STSTN website for people that they could potentially download from there.
Thanks. And I just wondered if Gary or Kofi wanted to comment on anything else they've done similarly or different. I know that Sarah Stewart-Smith done a really nice article for the STSTN News, which will be out shortly. Gary or Kofi, do you want to comment?
Yeah, I think that's a brilliant summary of what you did. I just wanted to find out whether going forwards is, because you talked about things like increase in waiting lists and all that. So whether you're thinking of using a mixture of virtual plus face-to-face, knowing a bit more about COVID. I think in a lot of cases, we kind of also looked at doing things virtually, but you highlighted some of the issues about patients not having access to sort of like the required broadband and so on, and stuff with attend anywhere, privacy and confidentiality in their own homes and stuff like that. So I was just wondering whether, like maybe just initially doing some sort of a virtual triage and then bringing patients in who you think might require face-to-face might be an approach.
I think it's been a really interesting time, because I think in the NHS suddenly we've been able to do things much more quickly, and being able to do that has allowed a lot more patient choice. For some people that might be at university that have quite mild sickle cell might not need to come to an appointment with us every week in person, but they might really benefit from the additional knowledge that we have within a psychology service embedded in haematology, rather than their local university support system. So it can be that we can access people without it having to have too much of an impact on their lives, but they're still able to access that resource. So I think it's really useful for us all to move with the times in terms of helping us all to be more accessible, to be able to improve people's quality of lives and care. So I think I'm pleased that we've been able to, I think that's something that's been helpful in COVID, to be able to sort of push forward some of these ideas and to make them more accessible for people, both in the medical clinics, but also in our psychology clinics as well.
Yeah.
But of course, within that, we give people choice. So with the shielding restrictions, we have offered people still face-to-face appointments, and some people are coming for those. And we've made sure that in those moments we are in full PPE and COVID secure. And we also still go to the wards in full PPE as well if people are in that level of distress.
Yeah.
Thanks. And Gary, have you got any comments? Because I know that you started doing the imparts virtually as well, which I thought was really interesting.
Well, we're about to.
Okay.
Not done this yet. But I just would echo exactly, really interested in presentation, Raselle, and I think just echo that. I think just struck by a number of patients who have now been coming to support groups and who we just hadn't seen before, and people that I've been having regular contact with who just simply weren't coming up for outpatient appointments, but now this is now a way that is much more kind of acceptable to them and accessible, and it's taken this to transform what we're doing. But if something good comes out of it, then let's great to hold on to that.
Yeah, I think the majority have kind of like favored the virtual approach, and so being able to get a choice, I think these are things that you would have taken probably years to establish under normal circumstances.
Yeah,
but
definitely.
It's kind of like speeded up. Yeah, so I agree with that. Yeah.
Brilliant. Okay, I can't see any other questions or anything. And I just want to say thank you very much to Kofi, Gary and Raselle, and to all the audience for their participation. I think it's been great to really put the focus on our psychology services. I know that I'm incredibly privileged to have always worked as a consultant in services where psychology has been absolutely embedded. First with Kofi, and then with Raselle, Heather, Nikki, and the rest of the team here. And actually, I cannot imagine what it must be like to not have the support that we get from our amazing psychology colleagues. So thank you for me, really, for the work that you do, both for the patients and also for the staff. And I hope that it's been interesting for everyone else, and they've managed to get some useful information. I think it has, and I think all our speakers, I'm sure, will be happy to be contacted if people have got further questions. So a big thank you from everyone, and have a good evening, everybody. Prepare for